Advancing Nursing Practice with Technology is our episode topic. My guest is Dr. Jim Ballinghoff, Chief Nurse Executive at the University of Pennsylvania Health System. Jim is also the Vice President and Chief Nursing Officer at Penn Presbyterian Medical Center and Assistant Dean for Clinical Practice at the University of Pennsylvania School of Nursing. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Well, Jim, thank you so much for joining us today.
Thank you for having me. I'm honored to be here.
Before we get started on today's topic, can you tell us a little bit about your organization, including size, makeup, service offerings, and locations?
Sure. I work for Penn Medicine, which includes the University of Pennsylvania Health System. We have 6 hospitals. All of them are magnet-designated hospitals. We have over 3,000, almost 3,500 beds. We have around 47,000 employees to serve those beds. We have 40 plus medical specialties, and we do over 6,500,000 outpatient visits each year. We do about 350,000 ED visits, and we have over 11,000 nurses employed in the organization, a little over 2,000 advanced practice providers, and just under 10,000 physicians. We span both Pennsylvania and New Jersey. We have a hospital in New Jersey. 3 of our hospitals are in downtown Philadelphia. And we also have a hospital out in Chester County and a hospital out in Lancaster.
And how long have you been with PPMC, and how long have you been in your current role?
I've been with Penn Medicine for 25 years. I've been at PPMC for 12 years. And I've been in my role as Chief Nursing Officer at Penn Presbyterian Medical Center for 11 years. I also serve as the Chief Nurse Executive for the health system, and I've been doing that for about a year.
And right now, and this may not be related to this episode topic, what is keeping you up right now as CNO at PPMC?
The emotional and physical well-being of our staff. That's what keeps me up at night. We're experiencing an uptick in violence and aggression, and it's having a huge toll on our nursing workforce. These are really challenging times in our profession and in our industry. Obviously, staffing has kept me up for the past 25 years, but I've learned to live with that. It's nothing new, but it's still constantly on the back of my mind.
And so today we're here to talk about advancing nursing practice with technology. And I'd like to start by reviewing AONL's guiding principles on leveraging technology to enhance clinical outcomes and learn how you apply them in your practice at Penn Medicine. So guiding principle number 1 is about establishing a culture of collaboration between the CNE, the CIO, and industry partners. Can you talk a little bit about what that looks like at your organization?
Sure. We have a very collaborative culture here at Penn Medicine. Our success is dependent on our ability to work together. We set goals together and then evaluate how to best move them forward. For example, if I'm evaluating technology, I look at it more from a workflow perspective. Is it going to be a positive or have a positive impact on workflow? Is it going to increase efficiency for our nurses? How will it impact our patient outcomes and experience? While my CIO partner looks at it more from a technical perspective, how will it integrate in with existing systems? Is there redundancy? Things like that. And then we share those perspectives with each other. And then when appropriate, We'll also pull in our industry partners to provide consultation and, if appropriate, products that will help us achieve our goals. I made an offer this morning for CNIO. This will be the first time that we've had a chief nurse information officer for our health system, and I'm really looking forward to have that resource to be able to partner even further within our organization
What's your vision for that role?
to really understand how technology impacts our nurses' work lives day to day. How can it help support them? How can it help them in achieving better patient outcomes, better patient experience? Really being an expert in what's coming down the road. It's coming fast and furious. Artificial intelligence is playing a big role for us. Predictive analytics is playing a big role for us. And how does that, what is the best technology out there to achieve those goals?
Guiding principle two is about building relationships and trust, particularly between the CNE and the CIO. What does that look like of relationships and trust for you at PPMC?
Sure. It's about forming relationships is critical, whether it's the CIO or any other department. There's
Sure.
very little that we can achieve on our own, and good relationships really helps move things forward more efficiently and more effectively. I have a great relationship with our CIO here at Penn Presbyterian Medical Center. I also have a great relationship with our CIO at the health system, our chief medical information officer at the health system, and we've partnered on many different projects. Or Nurse Call on how that works. We've done it with our pump integration, vital sign transmission. We're evaluating virtual nursing right now, ambient listening. I work with them around documentation hygiene to improve documentation burden for our nurses. It's critical that you have good relationships with our CIO partners.
Are there any sources of common threads of conflict that seem to exist between those two roles of ongoing, regardless of what project that you're working on?
Sure, I would say money, the
Okay, fair point.
finances. We both have great ideas. We both want to test out new technologies are out there, identify new opportunities for that. And typically, finances will constrain us in those areas. And then also, staffing can be a challenge for us and prioritizing. We come from from different perspectives, and what I might prioritize, they might not see as a priority, or they might not have the resources at the time. So that can be conflict as well.
Guiding principle number three is about creating strategic and operational alignment of IT solutions. Two key goals within it are developing an inclusive roadmap for IT strategic planning, as well as to tie every IT project to the organization's strategic goals and plan. So, what does that look like for PPMC?
I think we do it very well at Presbyterian, and we also do it very well at the system level. We have both a nursing strategic plan and a system strategic plan. Our framework and imperatives for our nursing strategic plan are wellness, systemness, and outcomes. And in previous strategic plans, IT was always a separate pillar. And now it's more integrated into every one of our strategies. Much like how innovation was a separate pillar. And as time went by, we realized that innovation had to be incorporated in everything we do. For an example, with our wellness imperative, information technology is going to play a major role in decreasing burnout with documentation hygiene. We way over document things that we really don't need to because we want to potentially have that information for a later date, but it's a real burden on nurses. We'll incorporate technologies that improve efficiency and ease of workflow for our frontline staff. And then with systemness, we'll evaluate how to best standardize technology across the system. A lot of times we will incorporate different technologies, and we really need to look at one single standard of care. What's that best practice? And how does that technology work into that? And with outcomes, we evaluate what are the best practices or evidence based interventions where technology has a positive impact on patient outcomes or experience.
Excellent. And so we've talked about the first three. Guiding principle number four is about establishing collaboration for innovation and transformation. And I'm sure we could probably spend the rest of this podcast and maybe even other episodes talking about this topic in and of itself. But what are some of the innovative things that you're working on right now at PPMC that you're able to share?
We're evaluating new models of care where technology can enhance workflow. That's a primary goal for us. And to manage a patient load is very challenging for our nurses. Patients are way more complex. So we need to look at technology that can support them. We're testing out artificial intelligence and how it can enhance in decision making and also automation to improve workflows. Really looking at predictive analytic tools that can help nurses focus where they need to focus. Triage tools where they can identify things that maybe on the surface might not necessarily be there. And it will help them hone in on the work that they need to do more efficiently and more effectively.
And are there anything specifically in nursing? You mentioned triage tools. Are we talking about triage in the emergency department? Are we talking about triage for other areas?
It could be for the emergency department, but it also can be for clinical practices. So if you get a call into a clinical practice, we could use a nurse and this artificial intelligence technology to identify where to best appropriately send that patient or determine how quickly they need to be seen. Should we be sending them directly to the emergency department, or should we, be getting them in that day? And I think that technology is going to expand and serve in lots of different areas. When you think about just triaging is really about what's that initial information that we're getting and how do we use that information to prioritize and make the decisions that we need to make.
It's such an important decision about getting the right patient to the right location for the right care in the right time. Are you in the investigative stage of that right now? Are you actually trying and implementing? Where are you on that journey?
We are in both. We're investigating and implementing. We're actually trying to implement in our ambulatory settings, but really you also have to understand scope of practice, making sure that we stay within our scope of practice when we're utilizing these tools and making decisions and making sure that we're not making decisions outside of our scope of practice. So it's great to have the technology, but then you have to really figure out how to work with it. And that's the phase we're in right now is we have it, we've implemented it, but now we're figuring out all of the little kinks and making sure that we are aligning with the goals that we're trying to achieve, but also keeping within that scope that we're required to stay within.
What's your top priority right now?
I think the top priority is to only integrate technology into practice and if it improves workflow and makes nurses' lives better and or improves patient outcomes. And we're evaluating virtual nursing right now. And we're evaluating it to potentially use it, virtual nurses, to help with the admission assessment and potentially discharge teaching. And if that nurse has to go down the hall, grab the camera, bring the camera in, set the patient up with the camera, provide education there, all to do the admission assessment, and they could have done that admission assessment in the same amount of time, that's not really supporting workflow and that's not supporting the nurse in any way. So we really have to evaluate how to incorporate technology that's going to support nurses, make their lives easier, make it more efficient for them, and or hopefully improve patient outcomes or and the patient experience. We recently implemented technology that will automatically transmit vital signs to the electronic record, therefore saving nurses time. And we also did this with a call bell system. So those little things that are really not big, but they are time consuming. So you do your vital signs and then you have to go sign into your electronic record and document all of that. Now it's automatically going, and that's just saving time for our nurses. Our call bell system that we just implemented, you can, when you walk into the room, it automatically turns the light off. Was it that big of a deal to walk over and go behind the bed and turn it off? No, but all of those little time savers just make it easier for nurses as they're trying to navigate their workday. I think a priority is really focusing on technologies that support and enhance workflow for nurses and not make it more difficult for them.
Yeah. So, what's some of the feedback that you've gotten from some of the frontline staff? Because what I hear you saying is it's not about getting more revenue. It's not about demonstrating a new outcome per se. It's really about making the work life better and patient care better together. Are nurses sharing any positive feedback from these new technologies that you're using?
Yeah, we've gotten mostly positive feedback from it because we have evaluated how to best incorporate it, utilizing their feedback into the processes. Right away, we realized that going down the hall to grab a camera, bringing it in, that was not effective. So we're working on having cameras installed in the rooms where you would just hit the button to access that, not have to go grab it. We also got some negative feedback around nurses felt that during the admission assessment, that was when they bonded with the patient. That's when they got an understanding of what was going on with the patient. And when someone else was doing it, and then there had to be a handoff, it just had a not necessarily a negative impact, but it impeded in some way in that relationship. So we're looking at it, maybe we won't use it for an admission assessment. But then when you think about discharge teaching, a lot of times we're pressuring, we have people waiting for these beds, we have people waiting in our emergency department, in our other portals of entry for those beds. We're pressuring people, the nurses, to get patients out as efficiently as possible. And sometimes discharge teaching can be a challenge, and patients might not get exactly what they should get because we're rushed. Where the virtual nurse can spend a bit more time with that patient, making sure they completely understand, making sure that all questions are answered, and we're not just handing them a discharge sheet and quickly going over it and helping them on their way. The virtual nurse can spend more time where while the primary nurse is doing other tasks or interventions for other patients and then circle back and help with that discharge. We're in the process of really evaluating and figuring out how this technology will be most effective for our nurses on the front line.
What are some of the greatest risks or barriers out there right now to achieving your goals? You mentioned money, which is a given, but beyond that, what are some of the other risks or barriers out there right now?
Sure, staffing is always a challenge, and it's gotten a lot better over the past several months, but turnover's almost doubled for most of us across the country. That means we have a lot more newer nurses into the organization. They're all risks and barriers to moving things forward. As you mentioned, financial constraints, but that's a reality for all of us. There's also human factors and staff buy-in. I did my doctoral work around patient handoff, and I tested a very unique piece of technology that had a handoff tool embedded in it that provided up-to-date information that you could trend. It had things that you just could not get from a paper tool. And we compared it to the traditional paper tool that they were using on the unit. And at the end of that project, we got very positive results on the technology. But a few weeks later, they just converted right back to their comfort zone, which was, that paper tool. And I gave them that choice. The choice was theirs. But it's that human factors that we really have to think about and making sure that staff are able to adapt and buy into those processes. So that can be a real barrier.
There's a lot of discussion out there right now about AI in many industries, including healthcare. We've talked about it already a little bit. Specific to nursing practice, what are your thoughts about AI, where it can be helpful, and where the risks may also lie?
Sure, it can help us get to decisions faster. Examples would be the triaging that I talked about earlier around acuity. Sometimes you might not recognize on the surface something that this technology might potentially pick up on, providing us with predictive analytics that can help us focus where we need to focus. Pressure ulcers is something that we're always combating here. And most of the processes we put in place are for all patients. And there should always be a level of that for all patients. But through predictive analytics and these technologies, we might be able to zero in better on who the most vulnerable patients are and hopefully improve outcomes in that way by zeroing in or being able to advocate for additional resources that can focus in on those areas. The downside that with this type of technology is that we could lose our own ability to critically think and develop our own knowledge base and clinical skill.
Yeah, you're talking about pressure ulcers as an example, and I, what comes to my mind immediately, of course, is the Braden score, right? And figuring out who's necessary for potentially a Q2 turn. What would that look like in an environment where we had the bed potentially telling us, hey, this patient's center of gravity hasn't moved in such and such a time. You need to turn them versus looking at a risk or an apparent risk score underneath that. That would be an interesting way to explore something like that.
Exactly. And you have to use it all, basically. You have to use technology to support. You have to use your own clinical knowledge and skill. And sometimes it's different technologies that you might be taking information from both of them and combining it to help you focus where you need to focus.
Yeah. Yeah, this has been a great conversation. Any closing thoughts as we wrap up this episode?
I would say that technology is coming at us fast and furious. And we need to consider the pace at which nurses can adjust and adapt. Nurses, every shift, it feels like we are introducing something new for them, some new process, some new technology, some new paper tool, something new in the electronic record. And we really just have to be cognizant of that because technology should really make nurses' lives easier and enhance the patient outcomes and experience.
Advancing nursing practice with technology has been our episode topic. Jim, thank you so much for taking time to discuss your thoughts and everything that you're doing at PPMC. I learned a lot, and thank you very much.
Thank you for having me.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.